This is Natalie Portman, who is one of my ducks, but I am using her to show a few concepts of restraint. Most of the wildlife that we see are birds, so she's a good example to use for the Canada geese that we see, for the mallard ducks, the wood ducks that we see, and with some variation I can show you on her some of the adjustments that we have to make for raptors. Obviously, she's not too much of a threat. Birds have no teeth and they don't peck very hard, and she's domesticated, so she's pretty gentle. But with our raptors, we have to worry not about web feet, but we do have to worry about the talons that hawks and owls have, so that when we're dealing with our raptors, one of the first things that we have to make sure that we have control of is the feet. And if you look, my fingers are between the 2 feet, and both feet are encircled so that we have full control of those feet, so that those talons don't come up and go right through your arm and cause some serious damage. With birds, we want to make sure that their wings are kind of tucked up together so that they aren't flapping around and doing further damage. Sometimes just pulling down on the feet is going to stabilize their wings. Otherwise, we sometimes wrap them in towels to secure their wings and just make sure that they're tucked tight against the body. We always want to make sure where the head is. Now, you don't see a bird's ears, but they're about where you would think they would be, and you can secure their heads by just holding their heads near where their ears would be. This is more of something that we use with the smaller birds, the songbirds, holding on to them, and I'll show you on a smaller bird how we do that. So when you look at a bird or a bird of this size, if you come across them on your own, if you're out hiking or somewhere where there is an injured bird, one of the things that we want to assess right away, if you don't have a scale around, is to feel their sternum or their breastbone. And you'll feel it kind of like the keel on a ship. And in a healthy bird, the breast muscles are pretty developed because they use them for flight, and it should be fairly rounded. You'll feel the point of that keel. Now, if that breastbone is sticking way, way up, that means that this bird is emaciated. It's probably been injured for a while. It hasn't been eating, and it's in much, much worse shape. So that's an important thing to look at. The other parts of the exam that you can look at visually, just look at their eyes. Is there any hemorrhage or bleeding in their eyes? Look at their openings called the nares in the beak to see if blood is coming from those areas. Birds often get hit by cars, so that we're going to see blood coming out of the nose, or sometimes if they open up their mouths, we're going to see blood coming out of the mouth. When we examine the bird, and I'm going to lay this bird down a little bit to examine this bird. I'm at home now, so I am using my dryer to spread this bird out, and I'm doing it by myself, but with assistance we can examine the wings. We can make sure that there are no broken bones, there are no fractures. We can feel along all of the bones of the wings, and in birds the wings are really just like your arms. You've got the same bones in your arms that are in the wings of a bird, and we just feel along them for any swellings. You can always feel one side against the other to feel that there are no fractures. Open fractures are very serious. When the bone is sticking out through the skin, those are fractures that often cannot be repaired. Fractures of the legs, it depends where those fractures are, and we want to look at that. The other thing that we do with birds is that we flight test them. I'm not going to do a flight test of this bird, but when we flight test a bird, you don't throw them up in the air. You just put them on a surface like a tabletop height and see if they move off that tabletop, do they fall to the ground, or are they able to get some height? Sometimes these fractures, if they fly into windows or even into cars, they can get a fracture along that breastbone, and that's going to inhibit their flight, but those with time and rest will heal. In an ideal situation, we do flight testing in flight cages, but sometimes we have to make accommodations. when we don't have flight cages around.